Welcome, everyone. We're going to wait just one more minute till about three after, and then we will proceed. Thank you for coming. Okay. Well, welcome, everybody. We're happy to see so many people attending. I'm sure there'll be a few more trickling in. My name is Dr. Gene Bowman. I am the Clinical Trials Director at the McCance Center for Brain Health at MGH, and also an instructor in neurology at Harvard Medical School, and I moderate these sessions. We are very excited about three renowned scientists, clinicians who are joining us today. The first is Dr. Manson. She's a professor of medicine and the Michael and Lee Bell Professor of Women's Health at Harvard Medical School and professor in the Department of Epidemiology at the Harvard T.H. Chan School of Public Health and chief of the Division of Preventive Medicine at the Brigham Women's Hospital. Dr. Manson is a physician epidemiologist, endocrinologist, and the PI or co-PI of several research studies, including the cocoa supplement and multivitamins outcome, a Cosmos trial, the Women's Health Initiative Clinical Center in Boston, the vitamin D and omega-3 trial, the VITA trial. Her primary research interests include the randomized clinical prevention trials of nutritional and lifestyle factors related to heart disease, diabetes, cancer, and cognition, and the role of endogenous and exogenous estrogens as determinants of chronic disease, life course related risk factors for cardiovascular disease in women, and biomarker predictors of cardiovascular disease. Dr. Manson's received numerous honors, including awards from the American Heart Association, election to the Institute of Medicine, of the National Academies, the National Academy of Medicine, and the James D. Bruce Memorial Award from the American College of Physicians. Dr. Manson has published more than 1,200 peer-reviewed articles in the medical literature, making her one of the most highly cited researchers in the world. Also joining us today is Dr. Okereke. She is the Terry and Jean D. Gunsberg MGH Research Scholar, an associate professor of psychiatry at Harvard Medical School, and associate professor in the Department of Epidemiology at the T.H. Chan School of Public Health. She's also the director of geriatric psychiatry and the director of the MGH Psychiatry Center for Racial Equity and Justice in the Department of Psychiatry at Mass General Hospital. For the past 15 years, she's been an NIH-funded investigator focused on modifiable risk factors and prevention of adverse mental aging, including late-life depression, cognitive decline, and dementia, and reduction of health disparities in aging. She has led work that has appeared in such journals as JAMA, JAMA Network, Journals, Annals of Neurology, among others, and she's published over 150 peer-reviewed papers. Dr. Vyas is also joining us as an instructor in psychiatry at Harvard Medical School and instructor in investigation in the Department of Psychiatry at Mass General Hospital. He is a psychiatric epidemiologist with prior medical training and a PI and co-investigator on clinical and translational projects in large-scale studies. His primary interests include testing nutraceuticals and integrating multiple streams of data such as biomarkers and omics for the successful development of prevention strategies for psychiatric and cognitive outcomes. Dr. Vyas has peer-reviewed first author publications in JAMA Network Open, Journal of Clinical Psychiatry, the American Journal of Clinical Nutrition, among others. He's actively collaborating with different multidisciplinary teams of psychiatrists and other clinicians and epidemiologists from inside and outside of HEMS-affiliated hospital. He has leadership roles in scientific journals, including deputy editor in Contemporary Clinical Trials, associate editor in the Journal of Alzheimer's Disease, and academic editor in PLOS One. So today, starting with Dr. Manson, each of these investigators will present parts of this presentation titled The Cocoa Supplement and Multivitamins Outcome Study, or COSMOS, Effects of Interventions on Memory and Cognition. Welcome.
Thank you so much, Jean. Good morning, everyone. It's great to be here, and it's a privilege to be co-presenting this seminar with my close colleagues, Doctors Okereke and Vyas. Next slide, please. So just as a brief overview of the presentation, I'll be starting by giving some background on the parent trial of Cosmos and some of the key findings, particularly as they relate to cardiovascular disease and cancer. And then Dr. Okereke will be presenting in detail the Cosmos cognitive sub-studies from Cosmos Mind, Cosmos Web, and the methods of Cosmos Clinic. And then Dr. Vyas will be presenting in detail the Cosmos Clinic results and a meta-analysis that we conducted of these 3 separate placebo-controlled cognitive sub-studies. Next slide. So just briefly as a disclosure, Cosmos investigator-initiated trial of cocoflavanols and multivitamins that was supported by Mars Edge with Cognition and ancillary studies funded by the NIH, including National Institute on Aging, as well as Mars Edge, and Pfizer Inc., which is now Haleon, and Mars Edge donated the study pills for this trial. The multivitamin used was Centrum Silver. Next slide. So this slide shows brief overview of the design of the Cosmos trial, and I'd like to acknowledge and thank my co-PI on Cosmos, Dr. Howard Sesso. The overall Cosmos trial, parent trial, was more than 21,000 participants nationwide. There's about 60% women. More than 12,000 were women above the age 65 and older, and close to 9,000 were men 60 years and older. And they were free of diagnosed cardiovascular disease such as MI and stroke, and also free of recently diagnosed cancer in the prior 2 years. This was a 2-by-2 factorial design, which means that we were able to look at the independent as well as joint effects of the interventions of the cocoflavanols and multivitamin interventions. The participants were first randomized to the cocoflavanols, 500 milligrams a day, then each group versus placebo, then each group was further randomized to multivitamin versus a placebo. So in total, there were 4 randomized groups. The median treatment period was 3.6 years. The primary outcomes for the parent trial was cardiovascular disease, total cardiovascular events, MI, stroke, CVD death, and revascularization procedures, as well as total invasive cancer. For the flavanol trial, the main outcome of interest was CVD, and for multivitamins, the main outcome of interest was cancer. We had baseline blood collections in a large number of participants, and then the baseline clinic visit, which you'll be hearing about in detail, included about 600 Boston area participants who had a baseline assessment prior to randomization, as well as a follow-up visit at 2 years, during which cognition was assessed, as well as deep phenotyping of cardiometabolic risk, and in many other parameters were assessed at that visit. Next slide, please. Okay, I had shortened the slides. Yeah, next slide, please. Okay, so I'm just going to very briefly, so I don't want to take too much of your time on the parent trial background, because we're really focusing on cognition here. So this slide shows on the left panel is the cumulative incidence rates for the primary endpoint of total cardiovascular events, where you can see in the green box, the hazard ratio was 0.90 with a 95% confidence interval, 0.78 to 1.02, which very, wait a second. Chirag, can we go back? Anyway, which narrowly missed statistical significance. And are we going back? Okay, and then the on the right panel shows one of the key secondary endpoints, which is cardiovascular death, where we had a hazard ratio of 0.73, which was significant. Okay. The p-value.
Doing great,
was,
Dr. Manson.
Pardon?
You're doing great. Who knows what we'll throw up here.
Right. Yeah. This is like a test of some sort. Open the window that's locked. Okay. So the hazard ratio there was 0.73. We thought it would be simpler having just everything together in one slide set and just sharing the screen once. Anyway, the hazard ratio is 0.73 with a p of 0.04. We had other secondary outcomes that were also promising, but not significant. So overall, our interpretation is that for the cocoflavanols specifically, there were promising signals for CVD reduction, which were not conclusive and which need to be replicated in a second trial, which we are currently seeking the funding for and are optimistic about funding. Next slide, please. Next slide. Oh, this is multivitamins. Okay, go back. So in terms of multivitamins, as I mentioned, the primary endpoint was cancer and invasive cancer, and I'll explain why. But the trial was 3.6 years duration, so we really did not feel it could fully evaluate and test the multivitamins for cancer. The results were overall very mixed. We did see a signal for significant reduction in lung cancer, but other types of cancer were not reduced. And so we really consider the trial, this specific Cosmos result, to be pretty neutral for cancer. Next slide. This slide just shows that multivitamin, comprehensive multivitamin, does show evidence for absorption of the micronutrients that are included in the multivitamin caplet tablet. In fact, we saw the expected changes in some of these specific micronutrients that we measured in the vitamin D, vitamin B12, and folate. Next slide, please. So why were we interested in multivitamins in cancer? I just want to give this as some background in interpreting our, it's blocking the screen. Okay, we were interested in looking at cancer because previously a trial that we did within our division, the Physicians Health Study 2, which lasted 11 years, had shown a significant reduction in cancer with multivitamins. It was a very small, modest reduction, a hazard ratio of 0.92 that was statistically significant. This was led by Mike Gaziano. However, if you think about total invasive cancers, around the world, this 8% reduction would actually translate into a very large number of cancers prevented. Next slide, please. So as you may know, the U.S. Preventive Services Task Force published I'm sorry. I want to just mention that for cancer mortality in Physicians Health Study 2, we also saw a signal there of 0.88, and we saw a stronger signal among the older men who were 70 and older, which may be related to decreased absorption. of micronutrients in the diet at older ages or other factors that can influence nutritional status in older adults. But there we saw 0.82 as the hazard ratio for cancer, with a P for interaction by age of 0.06. Next slide. Now, the U.S. Preventive Services Task Force 2 years ago published a meta-analysis of results for multivitamins, as well as some other micronutrients in relation to cancer and CVD. And although they did not end up having a routine recommendation or a general recommendation for routine use of multivitamins for prevention of cancer or CVD or all-cause mortality, their meta-analysis is, you can see here highlighted in yellow, based on 4 separate randomized trials, including Cosmos, was a hazard ratio or odds ratio of 0.93, which actually was a statistically significant reduction in cancer with multivitamins based on these 4 trials. And based on 9 randomized trials that looked at all-cause mortality, it was a very marginal 6% reduction, which is not bad for all-cause mortality in randomized trials, especially since many of these trials were fairly short-term. And CVD events was a pretty neutral, as has been found in the individual studies that have looked at multivitamins and CVD. Next slide. So at this point, I'm going to turn the mic over to Dr. Okereke to talk about the cognitive sub-studies in more detail.
Thank you, JoAnn. That's a great intro to Cosmos, and I'll be discussing, as JoAnn said, the Cosmos cognitive sub-studies. These were 3 separately conducted cognitive ancillary studies to the Cosmos trial, and these were the Cosmos Mind, Cosmos Web, and Cosmos Clinic. So in the schematic, you can see the numbers of participants who have been randomized in each of them, the Cosmos Web and the Cosmos Mind. And the Cosmos Clinic were a subset of those who were part of that CTSC cohort, clinical research cohort in Greater Boston. As Dr. Manson mentioned, there was some overlap among participants who happened to be in each of the studies, but not perfect overlap. So you'll be hearing at the end from Dr. Vyas about how we did a meta-analysis of the data from the non-overlapping participants, of which there were nearly 5,000. So I'll go through each of these studies one by one. Cosmos Mind was led by Drs. Laura Baker and Mark Esplan of Wake Forest University, you see at the top left. This study featured 2,262 participants who had repeated cognitive assessments over 3 years of follow-up using an established telephone-based cognitive battery. The Cosmos Web is led by Drs. Adam Brickman, Loken Young, and Scott Small of Columbia, and that featured 3,960 who were randomized and 3,562 of whom completed at least one follow-up and made up the intention to treat sample in their analyses. They were evaluated annually with an internet-based battery that was a self-administered internet-based battery of neuropsychological tests for 3 years. And then finally, the Cosmos Clinic was led by our Mass General Brigham team, including myself and Dr. Vyas, along with the efforts of Dr. Pamela Rist, you see here at the top right, along with the Cosmos PIs, Dr. Sesso and Manson. And Cosmos Clinic featured 573 participants, as I mentioned, in Greater Boston, followed up at 2 years following a baseline in-person cognitive assessment of a detailed in-person cognitive assessment. So all of these sub-studies assess the effects of cocoflavanols and multivitamin with mineral agents on cognitive function in persons who were age 16 and above or 65 years and above. Next slide. So the cognitive assessment in Cosmos featured the TICS-M, or TICS Modified, Telephone Interview for Cognitive Status Modified. It's a test of general cognitive function. Also a delayed 10-word recall from the TICS and the immediate and delayed story recall trials. These were to assess memory. Then finally, the oral trail making test B, oral trails B, verbal fluency, and digit span and digit ordering, which were used to capture executive and complex attention functioning. The primary outcome within Cosmos Mind was a global composite score that averaged the results from all of these tests by averaging z-scores from all of these tests. And then secondarily, there were cognitive domain-specific cognitive scores that were constructed in memory and executive function. So the cocoa extract actually had no significant effect on global cognition. However, the daily multivitamins with minerals resulted in a significantly better global cognition compared to placebo. This effect, when compared to the estimate of age, so we think about that as a great way to sort of clinically translate these types of results, was equivalent to about 1.8 years of slowing aging, sort of slowing cognitive aging. And then also these investigators found that this effect was most pronounced in those people who had a history of cardiovascular disease. The benefits of multivitamin with mineral were also observed for cognitive domains of memory and executive function, and there were no interactions between the agents, that is cocoflavanols and multivitamins with minerals, on cognition. Next slide. The Cosmos Mind investigators also explored the effects of multivitamins on incident cases of mild cognitive impairment, or MCI, in dementia. There were 110 cases of MCI, 14 of dementia that were identified over the follow-up. And this was done through a multi-step process of adjudication. There were persons who were with objective scores on their tics that were sort of below validated cut points of performance over follow-up. And this information was supplemented using the DQ, or dementia questionnaire, which is done with reliable informants. All of these reports were combined, the subjective and objective cognitive data were combined with available clinical history and data, and an adjudication committee arrived at agreement regarding classifying people into one of four groups: either no cognitive impairment, mild cognitive impairment, including the subtype amnestic or not amnestic, dementia, and a fourth category of unclassifiable due to missing or invalid data. So as shown on this slide, there were no effects of the multivitamin with mineral on risk of either MCI or dementia over 3 years. However, it was interesting that in looking at the actual data estimates that in the year leading into the development of incident MCI, these reductions in global cognitive and executive function scores were shallower than those on the placebo group. Sort of suggesting that multivitamins with mineral may be slowing the conversion to MCI. And then the results for dementia we see were totally neutral, but there were very low numbers of cases. That's noteworthy, and that's likely because these are individuals who are generally healthy at baseline. So caution is really needed due to the low statistical power and relatively short duration over time for observing incident cases of dementia in people who are healthy at baseline. Next slide. So now we're onto the Cosmos Web. So the Cosmos Web conducted these internet-based tests that were administered by the participants on their own. And these images show the test from the protocol. So the testing protocol was designed to be particularly sensitive to changes in hippocampal-mediated memory, given the important role of the hippocampus early in the transition to the impairments of memory and aging. So these three tests were the MOD-RAY, MOD-BENT, and the flanker task. We'll start with the MOD-RAY, which is up top. So the MOD-RAY is short for Modified Ray Auditory Verbal Learning Test, which I'm sure is familiar to many of you on this meeting. So this is a test of episodic memory, and it was the pre-specified primary outcome of Cosmos Web. So in this test, people are shown these study list words. They have to recall as many as they can immediately, and then after a delay. In the middle, we have the MOD-BENT, which is short for the Modified Benton Visual Retention Test. Again, another one of these classic neuropsychological tests, been around for decades. This was modified by the team at Columbia to be more relevant for testing memory in older adults. It's designed as a sensitive test of dentate gyrus function and visual object memory. So you see these sinusoidal, what's called Lissajous figures. They're designed to evoke the ability of pattern separation. So pattern separation is something in which the dentate gyrus is particularly involved. So participants are asked to click on the figure that looks like the one they just saw and do so as quickly as possible. And there are recall and recognition trials. And then finally, at the bottom, the flanker task. This was used to assess prefrontal cortex-based executive function capacities of selective attention and inhibitory function. So it may not be apparent just from looking at the picture, so I'll explain a little bit about what is going on here. So there's a target stimulus in the center, and that is what the participants are supposed to respond to by pressing the left or right arrow, depending on the direction of the target stimulus. But that target is surrounded by non-target stimuli. So the degree to which these distractors are present, such as surrounding stimuli, either in an incongruous direction or an incongruence of the color and direction of the target and the surrounding stimuli, this will increase the load on executive function to perform the test correctly using adequate attention and response inhibition. So next slide. So the results in the Cosmos Web for cocoflavanols are summarized here by this graphic from the investigators, the Cosmos Web investigators. They designed their study with the hypothesis, which had been supported by many earlier years of mechanistic evidence in smaller scale trials. They had led that dietary flavanols might specifically be associated with the hippocampal dependent memory, and that the extent of memory benefits of a flavanol intervention would therefore likely depend on the baseline habitual diet quality. So at the start of the trial, individuals with higher habitual flavanol intake, this was measured through diet, a diet measure through questionnaires, as well as a flavanol-related urinary biochemical marker reflects this as well. They had better memory performance than those with lower intakes. The pre-specified primary endpoint in the Cosmos Web was the change in memory on the MAD-RAY test after 1 year. So for that outcome, there was no significant effect overall of cocoflavanols on the total sample after 1 year. However, consistent with their hypothesis, what they observed was that there was a significant benefit of cocoflavanols agent for memory in the persons with the lowest tertile of dietary quality and lower levels of urinary flavanol biomarker. And what was important is that the project was able to show that this benefit was achieved through normalization of the low flavanol group after 1 year of treatment with the intervention. So by normalizing levels among individuals with low dietary quality and low flavanol consumption, not only were there improvements in memory in this group, but their performance was brought up to the level of the people with higher dietary quality and intakes at the start of the trial baseline. Next slide. So this slide summarizes the multivitamin with minerals findings within Cosmos Web. There were significant advantages of the multivitamin with mineral agent compared to the placebo 1 year on the MAD-RAY test. That's the pre-specified primary endpoint. And then furthermore, over 3 years of follow-up, this benefit of the multivitamins with minerals compared to placebo was sustained and remained significant. So this averaged to a benefit over the course of the trial of 3 years less cognitive aging, so slowing cognitive aging by 3 years. This benefit was not seen with the other tests. Next slide. Okay, so finally we come to the Cosmos Clinic, which I'll review very briefly, just the methods, as Dr. Manson mentioned, and then Dr. Vyas will go into the detail about the results. So there were 573 individuals who completed the testing battery at baseline, and this was repeated 2 years later. This was an in-person cognitive assessment protocol consisting of 11 tests: the modified mini-mental state, or 3MS, the CIRAD, or Consortium to Establish a Registry for Alzheimer's Disease, immediate total list learning, delayed recall and recognition, immediate and delayed recall trials of the East Boston Memory Test. There were 2 category fluency tests, naming animals and vegetables in 60 seconds, trail making tests parts A and B, and the digit span backwards. Our primary outcome was the global cognitive Z-score that averaged the 11 tests. And this score was constructed such that higher scores would reflect better cognitive performance. So the tests like the trails that are reverse scaled on the raw scale, they had to be reversed and normalized prior to averaging. So secondarily, we also aimed to test the effects of these agents on an episodic memory composite. And this was created by averaging the Z-scores of the East Boston Memory Test, immediate and delayed recall trials, and the CIRAD, immediate total list learning and delayed recall. We also created an executive function attention composite, which averaged the Z-scores of the 2 category fluency tests, the trails A, the trails B, and the digit span backwards. So now I'll turn it over to Chirag to present the results.
Thank you, Olivia. So I would like to walk through the main key findings of the Cosmos Clinic. So overall, in Cosmos Clinic, cocoa flavonols were neutral for cognitive function. Secondarily, we were interested in examining whether the effects of cocoa flavonols on cognitive function modified by uh, the adherence of healthy diet, which was measured by Alternative Healthy Eating Index 2010, or flavanol consumption, which was measured using the urinary biomarker. In this sample, we found that cocoa flavonols were suggestively beneficial among those participants who started with the poor diet quality at baseline. We did, and the findings were prominent for the executive function. We did not see any benefits for the episodic memory in this subgroup. This slide represents the main findings of the multivitamin mineral supplementation for cognitive function in Cosmos Clinic. Over 2 years, MVM supplementation versus placebo showed modest but better change in global cognition with significant improvements in episodic memory. There were no benefits of MVM supplementation on executive function or attention, and it should be noted that the mean scores in both treatment groups were increased over 2 years. However, the extent in this increase were differed between these two groups, and these increments may also suggest the practice or learning effects. Finally, we were interested to assess the strength of our evidence regarding the MVM supplementation on cognition within Cosmos. So we performed a meta-analysis across all three cognitive sub-studies. We pre-specified two cognitive outcomes. The first outcome was global cognition, and Cosmos Clinic and Cosmos Mind contributed to this outcome, and we included over 2,700 non-overlapping participants from the clinic and the mind. The Cosmos Web, as Dr. Okereke mentioned earlier, it was specifically designed to measure the hippocampus-mediated episodic memory, so it did not contribute to the data for this outcome. This table provides a list of cognitive measures administered in Cosmos Clinic and Cosmos Mind. And as we can see, both Cosmos Clinic and Cosmos Mind had parallel but not identical test measures to ascertain global cognitive outcome. For example, to measure the general cognition, Clinic administered the 3MS test, while the Mind administered the TIC-SAM test, as well as the immediate and delayed recalls, as well as fluency tests, as well as trails were administered in parallel in both studies. The second pre-specified outcome was episodic memory, and all three sub-studies, Clinic, Mind, and Web, contributed to this analysis, and we included over 5,200 known overlapping participants across these studies. This slide represents the key findings of the meta-analysis across all three cognitive sub-studies, and we observed strong and consistent benefits of multivitamin supplementation compared to placebo on preventing memory loss and slowing cognitive aging in older adults. While the summary effect estimates for global cognition as well as the episodic memory were modest, they remained statistically significant. The p-value for global cognition was 0.009 and p-value for episodic memory was 0.007. Overall, this meta-analysis suggests that 2 to 3 years of MVM supplementation appeared to slow cognitive aging at least by too few years within Cosmos. So what are the next steps? Cosmos had modest racial and ethnic diversity and included nearly 10% racial and ethnic minorities in the sample. And all three Cosmos studies had over 2 to 3 years of cognitive follow-up. So the findings need to be replicated in a more diverse with longer term follow-up trial, as well as it is unknown whether the participants who are genetically at risk for cognitive decline whether the benefits can confer MVM confers cognitive benefits among those participants. Also, it needs to be evaluated how MVM confers the cognitive benefits. What are the biological mechanisms underlying in this observed findings? Also, further research is needed to determine which specific vitamins or minerals of multivitamin mineral supplement explain the observed cognitive benefits in the study. In conclusions, Cosmos features a unique study design that integrates 3 cognitive sub-studies, each administering different modes of cognitive assessments. And in all 3 cognitive sub-studies, multivitamin mineral supplementation showed promise for slowing cognitive aging as well as preventing memory loss. Additionally, cocoa flavonols showed some benefits for cognitive function, especially among those with lower diet quality or lower flavonol consumption at baseline, and additional research is needed in this context. By that, we would like to end our presentation, and our contact emails are listed on the slide. Thank you very much.
Okay, thank you very much for that wonderful presentation. A wealth of data there to process for many of us, I imagine. I just want to remind everybody that if you have questions, you can post them in the chat. You can also raise your hand. I'd be happy to call on anybody that has questions. I have several questions, being somebody that's embedded in the nutrition and brain aging field for quite some time. A few things that I noticed from the data that you present and your publications is this theme by which there is a subset of individuals that seem to be responding at a greater magnitude than others. And I'm wondering if through that knowledge, whether it's the flavanols that have poor flavanol intake, that then that were randomized to flavanols and you see some benefit signals there, or the multivitamin minerals, whether or not you've been able to identify potential thresholds by which either the flavanols or the multivitamins or minerals are achieving that are offering this neuroprotective effect, whether it's through nutritional biomarkers or even dietary intake that changes over time. I think Dr. Manson.
Yeah, I actually want to leave this to Dr. Okereke and Vyas to respond as well, but I just want to make the comment that for multivitamins, it was an across-the-board benefit. And that is actually what's most impressive. For the primary endpoint in all 3 of these ancillary studies, it was, kind of meeting its primary endpoint across the board. And even though there was a bit of a greater benefit among those with prior cardiovascular disease in Cosmos Mind and Cosmos Web, there still was a significant benefit in the entire tested population. This was in contrast to the cocoa extract, where it was only within subsets where there appeared to be benefits. And if you looked at the overall study population, there wasn't a clear signal for benefit. So we think that that is an important distinction. And, I would be happy to hear Dr. Okereke and Dr. Vyas weigh in on this issue as well.
Sure. Thank you, JoAnn. I'm happy to add a little bit to that. I think you really summarized it quite well. Just with regard to the fact that with the cocoa extract, we see that the benefit was constrained within the Cosmos Web, for example, to this very sensitive test of hippocampal-dependent memory. We have to keep in mind that that sub-study was really constructed around a very mechanistically driven hypothesis. So these investigators have spent the better part of more than a decade studying particularly how the flavanol compound may benefit memory. And they had data from publications they've had in Nature Neuroscience, I believe, proceedings from the National Academy of Sciences, from earlier smaller trials that I had alluded to, suggesting that there's a particular benefit for the structures that they were eliciting using the particular memory tests that they were focused on within the hippocampus. So they hypothesized that the hippocampus, the hippocampal mediated memory would be particularly sensitive, but something like the recognition part that's related more to the entorhinal cortex would not be. They have a hypothesis about the dentate gyrus, evoking that with the Mott-Bent test, the Benton visual retention test. And so they had very specific hypotheses about the role of the flavonoid, the flavanol extract for people who were impaired in terms of their baseline content of flavonols. And so that was a very strong prior. Now, it turns out, they did do the test of sort of overall, does this benefit memory in the full sample? But that's why it was such an important finding. And they did publish in a quite prominent journal on the basis of the finding that this randomized double-blind placebo control really proved the hypothesis that they had kind of been building on for nearly a decade. In terms of seeing that benefit in the subset of individuals with the poor dietary quality or the low flavanol biomarker levels. It was interesting that when we looked at this within the other sub-study, that we saw, more of a signal in the direction of picking up a benefit potentially for individuals who had poor dietary quality for the global score and the executive function, and not as much for the memory. But we have to be cautious there because we were not using the very specific tests of memory that called up the very, very finely tuned function of hippocampal mediated memory that the Cosmos Web investigators were aiming for with their design of the study. So I'll just say that. And then I saw there was a question in the chat about, can the presenters comment if they take a multivitamin? So I'll just say briefly that, yes, I've been taking a multivitamin since even before the Cosmos study began, but I'm a big believer in that. I'd also participated in another study led by JoAnn Manson, which was, of course, the vitamin D and MACP trial, which you alluded to earlier during JoAnn's introduction. And during the entire duration of Vital Depth, because I was an ancillary R01 PI, I took 2,000 units of vitamin D and 1 gram a day of fish oil. I feel like if we're going to ask our participants to do it, we better be willing to do it too. So that's my answer to that question.
Let's see, Dr. Vyas, did you have a comment related to any of these questions?
So yeah, so I think I agree with JoAnn and Olivia on their feedback, but I just want to elucidate that Cosmos Clinic was a smaller subset compared to Cosmos Web, but we do see a similar signal for cocoa extract on cognitive function, for at least for the global cognition. So although the results can't be comparable due to the difference in the sample size, but we do see some signals there. Yeah.
So, I mean, if there's no other questions, of course, I have several questions. And while we have you here, I mean, I think looking at, the tertiles of flavanol intake at baseline and seeing response, and also in the multivitamin mineral, perhaps seeing a stronger response in those that have lower intake of particular nutrients. Can you give us a sense of what are we talking about here in terms of flavanol intake? I mean, the lower tertile of flavanol intake, or are you able to characterize your population's baseline nutritional status and put that into some perspective for us so that we can understand who's responding here? And so, for example, Olivia was talking about, she's taking fish oil and multivitamin minerals and, on the basis that she's asking her patients and trial participants to do these things. But, of course, we know that the effects of nutritional biological function is only linear through a certain dynamic range, right? So I'm wondering, within the range of, concentrations of these particular combinations of nutrients or the flavanols that people are entering, um, who are the people that, I mean, are you saying that we should be targeting everybody that's at risk or has this hippocampal mechanistic phenomenon that's occurring? Or do you think it's really a subset of the population that we could identify with nutritional biomarkers or even a dietary survey that you could say, aha, these are people really that should get the flavanols or the multivitamin mineral?
Well, again, I just want to highlight that for multivitamins, it wasn't dependent on diet, and it was across the board. And although no dietary supplement should ever be perceived as a substitute for healthy diet, it really does suggest that a multivitamin could be complementary to diet, healthy lifestyle, as a way to impact cognitive function. And just to, because Olivia shared, her use of multivitamins and vitamin D omega-3s, I will just share that I do take a multivitamin and have for many years. And I think if you consider that all of these previous trials of multivitamins have really not identified risks, any really consistent or meaningful risks. And this is such an affordable, accessible, and safe intervention that, in the U.S. Preventive Services Task Force report, actually 7% reduction in total invasive cancers based on 4 randomized trials, of great benefit to women during pregnancy, of course, but we're talking about prenatal vitamins, and also is now showing benefits, at least in older adults, in terms of cognitive function. It would seem that the benefit risk ratio is quite favorable for multivitamins, multiminerals, though we're not at this point making a blanket recommendation for routine supplementation. With multivitamins, still the focus should be on healthy diet, healthy lifestyle, but certainly any individual making a decision to take a multivitamin would have a lot of data to base that on. If you compare the data that have accrued on multivitamin supplements compared to almost any other dietary supplement on the market, those aisles and aisles of dietary supplements, it doesn't even come close, except for maybe vitamin D and omega-3s. Some of the other large-scale trials that have been done, there's been such limited data on these dietary supplements that are on the market. But, to answer your question about who might benefit from these, again, multivitamins, it seemed to be across the board. We really could not identify that those who had lower intake of X, Y, or Z benefited more. But of course, we don't have all the data to look at those questions. We did see the signal for cardiovascular disease. For Cosmos Clinic, it was people who were in the lower 5th, right? Or lower 5th or 4th of the AHEI score. So their flavanol intake could be looked at according to the studies that have been done of the alternate healthy eating index.
So would you say that, and before Olivia, we come back to you, but would you say, JoAnn, that the Cosmos trial is a strong representation of the U.S. public in terms of intake, meaning
of older adults,
yeah.
as was mentioned, it's not quite as diverse as the general U.S. population, but it's close. For older adults above age 60 and 65, in women, it's not really that different. So it's reasonably representative, but it doesn't mean that we don't want to see more data. Definitely want to see more data for both the both the flavanols, epicatechins, as well as more data on multivitamins to see if these results can be further replicated, and even in some different populations. different age groups, et cetera.
Thank you. Olivia, please.
Sure. No, I echo everything that JoAnn was saying, just really underscoring that the critical piece of the multivitamin and that meta-analysis that Chirag led for our group is you see that consistency across all 3 sub-studies, and it's for everyone. But with the cocoa extract, that you had a really great question, Jean, about what could be going on there, what's the recommendation we would take from this. So I just kind of wanted to circle back. So what the Cosmos Web investigators had shown was that if you look at baseline, the people who were, say, in the highest third compared to the lowest third, the highest tertile compared to lowest tertile, they performed better. So what does it mean to be in the highest tertile of baseline nutrition on the, the healthy diet quality index, or higher levels of flavonols? What that means is essentially these are people who are adhering to a healthy diet, and they're consuming adequate levels of the nutrients that contain flavonoid compounds. And there's a whole range, as some folks probably on this call know, I think 6 or 7 subclasses of flavonoids. Everything from, we talked about the cocoa flavonols, the flavontriols, catechins, and proanthocyanidins, anthocyanidins. They appear in many foods, berries, different vegetables, onions, oranges, right? So there are people who have a good broad diet of good foods, healthy foods, and a diversity of them, and they will have these higher levels at baseline. And so what the Cosmos Web investigators are sort of getting at is, if they think mechanistically, based on some of their earlier data, that the flavonol agent itself, the presence of these flavonols, is beneficial to the functioning of this particular part of the brain, then you're going to see that individuals who are low in this, if you're able to sort of induce a change so that you bring them back up to the level of the people who, had a healthier diet baseline, you should see, as they hypothesize, that they would then be able to essentially be normalized. And that's why, I'm assuming that's why they got published in PNAS. It's an exciting result to be able to verify that, that hypothesis that they built up experimentally in an RCT of humans, So I think it suggests, at the very least, in the Cosmos Web data, that individuals who do poorly on this particular test, they have a vulnerability, right? This is a vulnerability for memory impairment and aging. And that's very relevant to future risk of things like Alzheimer's disease. Although obviously this was not a test of prevention of Alzheimer's disease, but it's important that it at least was relevant to hippocampal mediated memory changes. So it does suggest that individuals who, and there are lots of older adults, right, who have reasons for chronically having poor nutritional quality. They may be in institutional settings, they may have various comorbidities, a bunch of reasons. And so I think while we can't say too much about that, we can certainly see that individuals who had a low level of baseline intakes and low profile of these agents, when they were given an adequate dose through this supplement and brought up to the level of the people who had normal levels or good levels at baseline, that it's benefiting them. So I think it does suggest, along the lines of the future studies, the kinds of things that JoAnn was talking about earlier for the next steps of this, and maybe how he's alluding to in the chat. It does suggest these are the kinds of things that can be further refined. But yeah, I agree with you that there's some important refinements in terms of the messaging of the for whom, that can be further explored.
Terrific. Thank you for the comments. What a delightful conversation here. Are there any other questions from anybody else on the call? I have a few more. So I have 2. I have one, in the multivitamin mineral, of course, there's no omega-3 fatty acids. There's no EPA and DHA. We've done some studies ourselves on omega-3 fatty acids targeting white matter lesions and neuronal integrity breakdown. And we see differential effects in ApoE4 carriers versus non-carriers. And this is a recent publication that came out in JAMA just a few weeks ago. And I'm wondering, have you looked at ApoE4 carriers versus non-carriers in any of these studies? And have you done any of the potential polymorphisms that are related to transport of these micronutrients into the central nervous system that could explain some of the results and also explain some of responders and maybe targeted trials for the future?
Olivia, you want to comment?
Sure. So I'm actually going to pass this one off to Chirag just to briefly say, for the Cosmos cognitive substudy, we did not have ApoE, for example, ApoE genotyping to look at the benefits in the carriers versus non-carriers of E4.
Okay.
But we had looked at some of this in a small subset of the clinic-based participants within the vitamin D and omega-3 trial. Depression endpoint prevention or vital depth. That was the R01 ancillary that I've been leading
Right.
within vital. And Chirag, I know you had analyzed this question in that smaller
Right.
subset. And generally, the interaction of the genotype with the
Treatment
agents
agent,
was
right.
the treatment
Non-significant.
agents was null. But maybe you can tell a little bit about the general results that we found.
Yeah, so that was a smaller subset where we looked into whether the ApoE genotyping modify the effects of vitamin D and omega-3 on cognitive function. And as Olivia mentioned, we did not see any benefits or more benefits among those with ApoE carriers.
Mhm.
But right now we are exploring more towards like subgrouping into the racial ethnic diversity, like minority groups, whether those groups can have like the ApoE genotyping and whether they can have more benefits for vitamin D in cognitive function. And that is basically using the prior work where we saw the vitamin D benefits for the cognitive function among Black participants. So we are further exploring that question among the ApoE carriers and non-carriers. But
Okay.
yeah.
Interesting. Um, I mean, some of the other polymorphisms around, methyl tetrahydrofolate reductase would be another one related to the B vitamin, of course, VDR for vitamin D,
Mhm.
those two. I mean, that you don't see the impact of ApoE genotype without the omega-3s and the multivitamin mineral could make sense that it may only be relevant to omega-3 fatty acid metabolism and effects on microglial activation and some of the mechanisms that maybe you're not tapping because you don't have omega-3s in the multivitamin mineral. But this has been a wonderful discussion. I think we're just about out of time. I just want to thank Olivia, Chirag, and JoAnn for joining us at the McCance seminar series. This has been wonderful to hear about these studies. Of course, personally, as a nutrition and brain aging person, this is very, very exciting work. I think I agree with all the speakers that the effects of the multivitamin minerals is extraordinary and remarkable and is probably underemphasized. Certainly in the cognitive health space, but it sounds like even perhaps in the cancer space, I learned today. And it suggests that some of this may actually be causal in the natural history of brain aging. And I think there's a lot of really interesting work that we need to carry forward. So thank you all for your work in this space, and thank you for coming to the seminar series.